Okay. Everybody see that okay?
Yes, ma'am. Thank you.
All right. So this morning, I'm going to talk about parental fitness evaluations. And it's going to be a brief presentation because I want to make sure we have some good time to talk about Laura's case. And so think about this as kind of an introduction to parental fitness evaluations, and that there's much more that we could dive into. Please stop me as we go with questions that you may have. So let's get started. Ooh, okay. I gotta find a place to put you all. Let's put you down. The top of my screen, that works. Okay. So I think first, let's talk about some definitions. So the first definition is what is a parental fitness evaluation? What do we mean when the court asks us for a parental fitness evaluation? I guess I should take a step back and introduce myself. I apologize. So I'm Dr. Colleen Lillard. I'm a clinical forensic psychologist, and I work at WVU at Chestnut Ridge. I also work part of my job with WVU is to actually be the statewide forensic clinical director. And so I oversee all kind of criminal forensic evaluations, competency to stand trial, criminal responsibility, those evaluations, the evaluators, and the treatment process for people. And so parental fitness evaluations are a type of forensic evaluation, but in a bit, we'll talk about how they're handled differently currently in the state of West Virginia. And so since I'm now the state forensic director, actually most of my clinical work involves parental fitness evaluations. And so my view of parental fitness evaluations is that this is a type of forensic evaluation that is used to assess a variety of things: the current and potential functional capabilities of the parent to meet the needs of the child, the relationship between the child and the parent, the psychological and developmental needs of the child, and then specific recommendations for intervention. And throughout this talk, if you're ever seeing the literature, you might see different evaluators writing this differently. The terms parental fitness, parental competency, parental capacity, parental adequacy, all of those words are often used interchangeably. I'm sticking with parental fitness as that's the word I've heard most often in the state of West Virginia. But just know that when you're seeing an evaluation or you're requesting one, that all of those would be used interchangeably. So here in West Virginia at this point in time, it's kind of the wild, wild west when it comes to parental fitness evaluations. And by that, I mean that there are no, to the best of my knowledge, there are currently no standards, protocols, codes, and by that I mean laws related to parental fitness evaluations, except for the fact that a judge is allowed to order them, and DHHR will pay for them. So we do have the ability to conduct them, and DHHR will compensate for them. But when I say there's no standards or protocols, I mean that there's nothing in the law that tells us who's allowed to conduct them. Can it be psychiatrists only, psychologists only? Can it be counselors, social workers, master's level, doctoral level? That is not specified, laid out anywhere. What specific qualifications do those individuals need to have? What do they need? What kind of background or expertise do they need? None of that is laid out in code. There's nothing laid out in code about what these evaluations should look like. And my apologies for my AirPods being dead, and the lovely baby in the background. And lastly, there's nothing in statute or code or policy, to my knowledge, about who oversees these evaluations, and therefore there's no quality control over them. So when I say wild, wild west, I just mean that the evaluations can all look very different. And some of that may be good and some of that may be bad. And it's hard for the courts and CPS and guardian ad litems to kind of understand this process. And so part of this is my hope to help you understand some of the best practices what it should look like so that when you see an evaluation, you can say, okay, this was a really strong evaluation, or maybe this was a not so strong evaluation. Any questions on that?
I guess, I'm sorry, can I jump in and ask a question?
Of course.
So this is deeply concerning because these evaluations are being used to decide custodial issues with regard to children. Like, are the judges are ordering these, are they aware of kind of it being not regulated?
I'm not sure. My guess for many judges, the way at least it works with other types of forensic evaluations in the States is the judges very much have a professional that is kind of their psychologist or their psychiatrist who they trust and who they have complete other types of evaluations for them, and that they tend to use those same similar people and just kind of go with this kind of broad trust that what they're seeing is a good product. And I don't necessarily mean that critically. There may be people out there conducting really good evaluations of parental fitness. I just think that it's not standardized in any way at this point in time.
And is there a movement to standardize the process, or,
There's been some conversations at the BSS level about that, but I don't think there are at this time. No plans from the forensic office anyways. But that is definitely something that, could be a further conversation that we could have. So my goal is to help you understand what to look for in an evaluation, and when to question whether or not this evaluation kind of best fits the needs of a person. Okay, so who are we trying to reach when we're conducting a parental fitness evaluation? Broadly speaking, we are trying to conduct these evaluations with parents who are at risk for child maltreatment or who have already had substantiated child maltreatment. Because the core question of a parental fitness evaluation is, what is the likelihood that this child will experience abuse and neglect in the future with this parent? And how do we minimize the likelihood that they would experience abuse or neglect in the future? And of note, it's important to keep in mind that the cause of this risk should be based on a mental illness. So when you're seeing these evaluations, there is some part of it that will look like a psychological or a psychiatric evaluation, because we are trying to connect this parent is at risk for future maltreatment because of this problem. And how do we help them in this area to make it so that they're less likely to abuse and neglect a child in the future? Okay, so why do these get requested? So I want to kind of throw this out to everyone that's here. We have a good crowd with us today. Can you guys tell me some of the reasons why you have requested parental fitness evaluations in the past, or for clinicians, you've seen parental fitness evaluations requested in the past?
I think we just automatically should go from what you just said. We're trying to see if the parent is fit, say in a CPS case, and also to determine what is needed in order for the family to be maintained, or what needs to happen treatment wise, what mental health issues need to be addressed.
Yeah, that's great. And Jennifer in the chat had a very similar comments yours, Dina. Yeah, so these are, what are the issues at play? Sometimes we don't always know. Sometimes CPS isn't going to have all the information. And so it's really important to kind of better understand what is maybe the mental illness that's at play, and what services or counseling might the parents need. So it sounds to me like providing recommendations for interventions is something you would be looking for in a parental fitness evaluation. Are there specific types of mental illness that raise a flag? Okay, we should request a parental fitness evaluation.
As a CPS supervisor, I'm going to say any that causes harm to a child, we need to see if it's going to adversely affect that child. Like, okay, so if depression was so severely bad that this parent is not able to get out of the bed or to do daily functioning, then we need to assess how bad that is and what it's going to, how we need to do with services. So I think it could go from, say, schizoaffective to depression.
Yeah,
But we have to do it based on not just, oh, okay, this parent has depression, based on the lack of doing daily tasks and parenting the child.
right. There's got to be that connection. I think that's really important for us to remember. And it's really important for evaluators to remember, because sometimes we as evaluators, we get lost in the diagnostic process of figuring out what's going on with someone. And we forget that, okay, but we're tying it to the risk of the parent's future potential abuse or neglect situation. So yeah, connecting it, and we'll talk a little bit about functional, why a functional assessment is important for that.
And in the chat, it says Jennifer Hall said something similar, which is to determine what services or counseling parents may need.
And at what point in the CPS process would it be most helpful to receive a parental fitness evaluation? What do you guys think?
This is usually something that we have as one of our standard terms and conditions of an improvement period.
Thanks, Brianna. Yes, so I often see this done as a condition of an improvement period, but I would actually suggest that that is too late in the process to conduct a parental fitness evaluation to really get your needs as the workers met. Because once they're in an improvement period, you're already in some ways maybe walking towards termination. And I've done many of these evaluations, and I'm sure it's really frustrating to the courts and to everyone involved in the case that I come back and say, look, I don't think parental rights should be terminated. I think you need to do this, 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 and this, and this parent can parent. And I think it's frustrating because then we've got to take the time. I know you guys are set on really tight timeframes, and if we hit 18 months, or is it 2 years from the case starting, you have to terminate. And so if you're waiting until the improvement period, you might not be giving the parent the time they need to actually improve. If these are severe mental illnesses, if these are substance use disorders, these are not issues that we can fix overnight. These are issues that are going to take time. And I worry that we're catching parental fitness evaluations too late, which is also what makes me concerned, because when I'm seeing parental fitness evaluations written, I'm often seeing an evaluator try to make a decision, terminate parental rights or don't terminate parental rights. And we'll talk a little bit later about how this is an ultimate opinion. And it's actually not as helpful as some other ways we could conduct these evaluations. If these evaluations were considered in like the pre-adjudication phase, then you would have some more time to be able to provide those services to the parent, or find those services for the parent, give them a chance to utilize those services or not utilize the services. And then you really have you've got 18 months to really understand, is this parent going to take the steps necessary to try to improve whatever weaknesses they may have, and make a better decision about whether or not their rights should be terminated. So yes, I agree, Brianna, that is what I am seeing frequently. But I hope by the end of this presentation, maybe there can be some conversation about having these evaluations conducted earlier. And I'm hopeful that evaluators will then utilize the evaluations not to give an ultimate decision, but to provide recommendations and treatment options. Okay, so sorry, there was slides on there was PowerPoint items underneath that. I was just looking at the chat. Tina said it seems like a no-brainer to have the evals done ASAP. I would agree. I'm sure that there's a lot of things that are going on pre-adjudication, and there may be actually reasons why that isn't often done. And I know evaluators such as myself sometimes take a little too long to get those evaluations back, and that can be frustrating for the court process. But I do think that it long-term is most useful for CPS, because you will have the evidence in front of you of whether or not this parent is taking the correct steps moving forward. Because it's really hard at these evaluations. I say they need long-term individual therapy, medication management. They should not have their medical marijuana card, but they're at 20 months. There's not a lot of time for that improvement. So I would, what I had underneath this purple box here, what I see happening most often, particularly in West Virginia, is that parental fitness evaluations are requested when the parent has a severe mental illness, usually something in the psychotic disorder realm, or a severe personality disorder, making it difficult for people to interact with the parent. Severe mental illness, cognitive disabilities. So whether there's a question about the parent's IQ and whether they can function independently themselves, and then care for the child appropriately. Substance use disorders and neglect comes up constantly for parental fitness evaluations. And I've also had a few parental fitness evaluations that are because of the parent's age. So when a teenager has a child, there's often a question of whether they have the capacity to parent. Those seem to be the kind of 4 areas in which we are seeing parental fitness evaluations. And when I say we, keep in mind, because there's no kind of quality control process, I haven't seen the range of all the evaluations in the state. I tend to see the ones that come across my desk, or ones that come across colleagues' desks. If they have some concerns or some questions, I see those ones. A little bit of history on parental fitness. I'm not going to get too much into the weeds about this, but Mitra will make sure that these get posted or get sent to you after the presentation, so you can take a look at it later. And so all of this, when it comes to the courts and parental fitness, kind of goes back to 1944 with Prince v. Massachusetts. This was a case in which it was determined that parents don't have absolute rights to their children. And it basically laid out a place in which the government could restrict parents' rights. And so it says that the care and nurturance of a child resides first in the parents, whose primary function and freedom includes preparation for obligations the state can neither supply nor hinder. And so that overall means that the government doesn't have the resources and ability to parent every child. And that parents, number one, it's very important, part of our life, liberty, and pursuit of happiness is that parents are allowed to parent their children in any way that they see fit. But this says until it crosses a line of abuse or neglect. So this was kind of the beginning of child protection services. We then have a case in 1982 called Santosky v. Kramer. This was the case that looked at what level of evidence does a person need to have in order to seek the termination of parental rights. And so these get a little bit confusing, but we have in criminal cases, you have to prove a case beyond a reasonable doubt. That says, like, I am 95% certain that this person is guilty of this crime. So as a juror, you're saying, I'm 95% certain this person is guilty. Or as the judge, that's beyond a reasonable doubt. Just below that, we have, or on the opposite end of that, we have preponderance of the evidence. That says I am 50.1% positive that I should terminate parental rights, or I should find this person guilty. We don't use that in terms of guilt because it's not a very high bar. It really is saying it's more likely than not that this person's rights should be terminated. And that was the standard for a long time. And the courts finally came in and said that's too low of a bar. We want it to be clear and convincing evidence. So in percentage terms, we think of that as 75%. So the court should be about 75% certain that the correct decision is to terminate parental rights, which makes it harder for the state to prove, which gives parents more of a chance to kind of stand their ground and not have their rights terminated. Another important case is Troxel v. Granville in 2000. So somewhat newer case. And when I say SCOTUS here, I mean the Supreme Court of the United States stated that parents have a constitutional right to rear their children as they see fit, as long as there's no abuse or neglect. And this case was known as kind of a blow to grandparents' rights. If I remember this case correctly, it was grandparents who brought the case up, whose son had died, and their daughter-in-law wanted to take the children and move far away from her. And so the grandparents said, but wait a second, we have rights. You can't take this child away from us. And the Supreme Court came back and they said, as long as that mom is not abusing or neglecting her children, she can do what she needs to do and what she feels is important when it comes to her children. And so this is where they say, like, when there's a fit parent involved, grandparents' rights do not trump that parent. And I'm sure I don't need to go over these, but it's here for you to take a look at different types of maltreatment that we're talking about. I find that more often than not, when I'm doing a parental fitness evaluation, it's because of neglect or concerns about future neglect. Physical abuse, sexual abuse, those types of cases I think are they are much more clear into what should happen to the parent. There's more rules and laws about how to handle those types of cases. It's when we get into these kind of murkier child neglect, emotional abuse type cases where we seem to want to bring in a mental health expert to say, what is the likelihood that this occurs in the future? Okay, so here's the part you guys, I'm sure, wanted to hear today. What makes a good parental fitness evaluation? The number one key to me is that the evaluation you receive should not just be a psychological evaluation of the parent. And I think more often than not, this is what gets submitted. While it's important to understand the parent's mental health needs and concerns, it often doesn't get directly tied back to their parenting skills. And so I would argue that the focus of these evaluations should be threefold. They need to look at parents' capabilities and deficits, which I tend to look at as their kind of adequate capabilities or areas that need improvement. And just so we know, deficits has a negative connotation. But what are the parents' strengths and weaknesses as a parent? And what are their strengths and weaknesses in that parent-child dyad or relationship? So first, we want to really understand parents' capabilities. Next, to understand these capabilities in the parent, we should use what is called a functional approach. This is the idea that we're focusing on the behaviors and skills that the parent has or needs to improve upon. So in these evaluations, it's really helpful to break them down by different types of areas and then talk about each of those different areas. And so this was a quote from that Bud 2003 article, but we're looking at what the caregiver understands, believes, knows, does, and it is capable of doing related to child rearing. Well, psychological evaluation isn't going to tell me that. To get that, I need to have conversations about parenting. So I can tell you in my personal evaluations, I have a long list of questions that are specifically tied to parenting areas. These are things such as, tell me, depending on the age of the child, but I found that many of these parents become pregnant again. And so I'm often checking in at all different kind of ages and stages of life with them. But we're looking at emergency management, medical needs. So how often does the child need to go to the pediatrician? What types of situations should you take the child to the pediatrician versus urgent care versus the emergency room? Why are immunizations necessary? Is your child up to date on vaccinations? If they're not, what are some of your reasons kind of for or against that? Are there certain vaccines that you're against, but not all of them? And again, we want to understand, what do they believe about vaccines and their children's health? We want to look at, I usually talk about things like what temperature equals a fever? And what do you do if your kid has 100.4 fever? And what do you do if your kid, when do you know that a fever means I got to take the kid to the doctor? And I'm not really trying, there's not always a right or wrong answer, but I want to hear their thought process. I want to better understand how this parent is going to think through things. Do they know I can call the pediatrician and there's a 24-hour helpline and they will give me advice on whether I should go to the emergency room or not? Or do they have a support system and people in their lives that they can trust by asking them these types of questions? So we go through medical stuff. We'll talk about nutrition in the same way. If they have an infant, we will talk about they breastfed or bottle fed, how often do they eat, how do you know if they're dehydrated, what kind of foods are unsafe for them, what kinds of foods are safe. We do this for car seat safety. We do this for we talk about safe sleep habits for kids. I go through the house that they're living in. Do they have smoke detectors? Anyone who's had a parental fitness evaluation by me knows that I get on them about carbon monoxide detectors. And I tell them this is my soapbox and I will stand on it because my whole family almost died from carbon monoxide poisoning about a year ago. So and if a parent doesn't know or doesn't have this information, this is where I educate them, because you've seen that last quote. It says, is the parent capable of doing the related area? So it's not about whether they have every answer for me, but if they don't, and I go back in a little bit and I ask them questions, can they have they learned from our conversation? Can they apply that information? And we do that about different safety issues in the house. We talk about schooling and the importance of school. I'm trying to go through my other questions. And so I guess overall, what I'm getting at with this functional approach is that the evaluator really should be asking parenting questions and knowing and getting a better idea of what this parent does know and what they don't. And keeping in mind that just because a parent has schizophrenia, just because a parent has an intellectual disability, just because a parent has a substance use disorder does not mean that they don't meet a minimum standard of parenting. It does not mean that their parental rights should be terminated simply because of one of those three areas. However, there are some cases where, say it's an intellectual disability, and I've evaluated the functioning and the parent doesn't understand how to keep the child safe, and the parent doesn't have a support system that can help balance out some of their deficits. That's where we want to talk about maybe parental rights should be terminated. But again, keep in mind, not just based on the fact that they have this mental illness or disability, but it's because that mental illness causes a deficit in their ability to safely parent that child, and they don't have the resources or the supports to balance out those deficits. Last part of a good parental fitness evaluation is that they're using what's called a minimal parenting standard. The idea with the termination of parental rights is that, and the parental fitness is this idea that, does the parent meet a minimal threshold? Unfortunately, we don't have a really great definition for what is minimal parenting, but we are not comparing these parents to the perfect parent or the ideal parent or a good parent, but do they meet the minimum standard to keep a child safe? And I think this is an important one to remember. And I think particularly for evaluators, this is the place where they need to be keeping in mind individual differences, cultural differences, different diversity areas and issues, because parenting very much is an area of judgment and an area where our lived circumstances and life experiences reflect in our parenting. And like the Constitution says, parents have they have a constitutional right to parent as they see fit, as long as there's not abuse and neglect. So we need to be really careful that diversity issues are not the reason we're saying this person can't parent. And where I see this coming up in West Virginia in particular is poverty should not be the reason we terminate parental rights. And so I think it's really important that we are piecing apart what is a lack of resources, and what, this isn't how I would parent my child. This is how the kind of the minimum level of parenting. And so I did want to talk about these, to me, these are not easy evaluations. These are not evaluations that I take lightly. These are not evaluations that I do quickly or without significant amounts of records, interviews with parents and other individuals in their life, their CPS worker. Do we get a chat? Oh, sorry. There was a question in the chat. I'll stop here. There's a question in the chat that asks how many providers we have at Chestnut Ridge or outside offices of WVU Medicine that administer these parental fitness assessments. Currently, we have 3. We have myself as a forensic psychologist. We have 2 forensic psychiatrists on staff who also conduct parental fitness evaluations. Outside of the 3 of us, I don't believe that anybody is qualified at WVU Medicine, within WVU Medicine, to conduct these evaluations. That's not saying they're not being done by other people, but those are the 3 that I would personally recommend to conduct them. There are other people and outside agencies all across the state conducting these evals. Oops. I don't want to watch my time. Okay. And so I just want to make a note that these evaluations are challenging. One, because predicting future behavior is really hard to do. It's a really tough thing even to ask professionals to do. We're not good at predicting behavior. We're good at managing future behavior. So I feel pretty confident in telling you, if you set up these types of services or these types of supervision or these types of monitoring, the likelihood of risk is lowered. But I won't give you a number because we're not very good. We're no better than chance at saying there's a 60% chance that this parent will abuse and neglect their child in the future. So what experts are good at is helping to put the barriers in place to safeguard the child and others. It's also challenging because there's not clear definitions. Competency to stand trial, we have a very clear definition. We have lots of research that tells us exactly how we should look at that definition. This is a much murkier area of evaluations. I think that these are challenging because there is a risk of quote, being wrong. I think that unfortunately, oftentimes the courts here in West Virginia, they want us to give an ultimate opinion. Sometimes the courts want us to be the person that says, yes, termination of parental rights should be considered, or no, parental rights should not be terminated, which then I think makes evaluators scared of, quote, being wrong. Do you say, no, don't terminate parental rights, and then something happens? And I think when this risk of being wrong comes into play, we tend to be very conservative in our decision making, and sometimes at the detriment of the families. And often with the courts wanting this ultimate opinion and giving us the, should you terminate parental rights or should you not? That is when we say ultimate opinion, that's a decision that the judge gets to make. That is his role and job to make that decision. My job as the forensic evaluator is to provide him with all of the information to help him make a very educated decision. It's much more helpful for me to say, look, here are their strengths. Here are their areas of improvement. If we look at their areas of improvement, here are the types of interventions that could happen to improve those areas. If they engage in these interactions, there's likely that they can safely parent their child in the future. Or if they remain on medication and doing therapy, they would be okay to continue to parent. I think that brings up, I know it's conversations that Laura and the group has had about, what recommendations should evaluators be giving or not giving. And I think evaluators have to be careful and have to be really up to date with knowledge or talking to colleagues. So for example, I don't think it's appropriate for people to say that a parent has to be off all medication assisted treatment in order to parent their child. Because again, we're looking at their mental illness and we're tying it to their risk, to the risk of abusing or neglecting the child. If that medication assisted therapy is keeping them functioning, it's keeping them interacting with treatment, it's keeping them stable, it's keeping them with a job, then it seems to me there's no reason that an evaluator should be saying they shouldn't have that kind of treatment. Now, that being said, this is where I think marijuana cards have started to become a bit more problematic, or medical marijuana has become a bit more problematic in these evaluations. I know I've done cases up in the Northern Panhandle, and these are people who often have evaluations in, or excuse me, often have medical marijuana cards in Ohio. And my take on the medical marijuana is that we know if a person, for example, has a psychotic disorder or predisposition to a psychotic disorder, medical marijuana is not the best option for them and may exacerbate their current psychiatric symptoms. So to me, the exacerbation of the current psychiatric symptoms pairs with their inability to function appropriately and could interfere with their ability to function appropriately and parent their child, which is where I start to question whether or not the medical marijuana card, even if prescribed for an appropriate condition, is an appropriate option. Those are just some of the hot button issues that come up recently. So you'll have this. This is just an example of what some of the things that should be in place. Let's see if my headphone will work. Give me just a second. My apologies. So this shows that we've got to first identify the referral question, which is sometimes vague. We have to review lots of background records. When I get a parental fitness case, I want the entire CPS file. And this has become an area of contention in some areas with some courts, because I'm not looking really at another parent. If you want to leave out another parent's records in there, that's fine. But I do want to see the medical records of the children. I do want to see if they're telling me that a wellness check should happen every year, and when the kid's little, it should be every 2 months, then I want to see that did they actually take their child to the doctor every couple of months? If they were getting mental health treatment, I want to know how they were doing, how often they're going, what are those visits like? So, and I want to take a look at previous CPS cases. And so I think it is extremely important that their entire record be provided to the evaluator. And then we administer testing. Again, a lot of unnecessary testing is conducted in many of these evaluations. One thing that gets often recommended that I have not been able to accomplish in my parental fitness evaluations is observation of the child-parent interaction. This is recommended or encouraged, but not required in parental fitness evaluations. I think we can make a parental fitness recommendations without this interaction. The problem I find is that these are parents who, many of them don't currently have visitation, or if they do, it's not very frequent. I'm having them drive quite a distance to come see me. It's just not possible for me to observe their interactions, but it would be wonderful to be able to see the child with the parent. Interview collateral sources. They talk about administering child measures. I can't imagine that that's necessary or appropriate in most cases. And then review and interpret assessment data and construct the report. You'll see these are different areas that could be examined in a parental fitness evaluation, many of which I think we cover in ours. And you'll have this in the slides. And then this kind of talks about areas in which the parent shows adaptive skills, or what are we talking about when we're talking about minimal parenting? So physical care, takes the child for immunizations regularly, provides regular nutritious meals. And then one area that would show deficits, if they're diluting the formula with water, if they're leaving the child unsupervised. So it kind of helps you look at some of the areas we're talking about. And then the second one looks at the parent's own competence of their own needs, which is important too, because like I said, maybe they don't have the ability to manage themselves independently, then we need to look at the resources that might be in place to kind of manage the parent, to manage the child. And then this just talks about, it's important to keep in mind factors that affect the fit between a child's needs and the parent's caregiving abilities. So different developmental stages are harder for some parents than for others. And it's important to keep in mind, there may be specific needs of a child. For example, maybe a child with a chronic medical condition that is going to require a lot more frequent visits, interventions, medication distribution. Those may affect the parent's caregiving capabilities. They may be able to parent a child without a medical condition, but not a child with a medical condition. So with that, I'm going to pause. So we have time to talk. Sorry, Laura, 15 minutes to talk about her case. And then answer any questions anybody might have about parental fitness evals.
My case is brief, so it's okay.
Okay.
Thank you so much, Dr. Lillard. That was a great presentation. But yeah, anyone with comments, questions, feel free to also utilize the chat feature. I'm happy to read it out loud. Giving it the echo pause there. And as always, if you have any questions that you think of, digest the presentation and later on you have a question, you're welcome to chat it in. We can always loop back around or address it after as well. Michelle says very interesting. Thank you, Michelle. But yeah, if you have any questions after the session, you can always email me. I'll loop it back to Dr. Lillard to have it answered for you. But thank you so much, Dr. Lillard. We appreciate you. All right, Laura, I have your case. I'm happy to pull it up for you and just let me know when you'd like me to scroll up or down. All right, are you able to see that okay?
Yes.
Awesome.
So this, Colleen, this is actually, let me get it so I gotta move my stuff around here. This is actually a parental bonding assessment. So I know you didn't talk about that, but I actually wanted to raise it so we understand the distinction, because both can be ordered by the courts and it's different than a parental fitness. So I kind of wanted to.
Yes, I apologize. I was going to have one slide at the end. Actually spoke with a forensic evaluator in the southern part of the state this week who is in court. And the court case had two different experts vying back and forth about whether or not a bonding assessment is appropriate. And so I have some research. I'll get it to Mitra to send out to everybody. But actually, this research that he sent to me was stating that bonding assessments are great for therapeutic purposes, but that using a bonding assessment to make a forensic decision is not appropriate. We don't have good evidence that our kind of attachment work, which is very important therapeutically, we don't have the data to say, okay, this level of bonding, yes, this level of bonding, no. And so actually I would raise the issue that a bonding assessment is not an appropriate direction for the courts to be ordering.
Okay,
but
that's actually really helpful as well, because as a therapist, I know that we can improve bonding, right? It's not like if you don't have the bond right now, you're never going to have it. And certainly in this particular case, which I'll talk about briefly, where kids have been removed early on as infants from the parent, the bond, and placed with a foster parent, we hope that the bond with the foster parent would look quite different than the biological parent, but that does not mean that the parent's rights should be terminated.
And I think the case that he was speaking of, it was something like extended family that lives in another state was trying to get custody of the child. And there was an argument that the foster family should keep the child because of the level of bonding that they had made. And then there was also lots of kind of individual difference and diversity issues that were coming into play.
So this is just briefly a case where the patient was referred to a bonding assessment by the judge, and right off the bat, she has no transportation and she had to I spelled Charleston wrong. She had to travel to Charleston for the assessment. So it was sort of.
There's apparently a psychologist in Charleston who thinks that it is his niche area to do all the bonding assessments in the state.
So the child had been removed from her custody for a year, and reunification was being considered, but had been in foster care, not with kinship, but just in straight foster care since the baby was an infant. And the assessment was done by, a contracted provider. So this patient had been actively engaged with CPS, was involved with the Child Advocacy Center, and her kids were involved there. She was involved in treatment with us, and doing all of her parenting classes and working full time. She had a lot that she was doing, and also doing urine drug screens between 1 and 3 times a week through day report. So the patient reported that this is how the assessment went, that the assessor, if you can scroll down a little bit, met with the foster family was there, the child was there, and she was there, which can be uncomfortable in and of itself. She did not have, she initially had a good relationship with the foster family, but it became clear that the foster family wanted to adopt the child, and then it became adversarial. So this was in that context where they were fighting to adopt this child, and really wanted her to have her rights terminated, as she describes it. So the assessor met with the foster family and the child, and then met with her alone without the child for 10 to 15 minutes. And then wrote the report. So typically my question is, typically would a bonding assessment require observing the parent with the child?
I mean, I would hope that it would. I imagine that it's a little bit probably. I would question whether they were concerned, was the parent having any visitation with the child?
Yes.
Okay, so
regular visitation was already happening with the child. Yeah.
Okay, because then I would say, well, if there's no visitation allowed, then I would be concerned that the evaluator is trying to take it. But I would feel like I need court's permission to be the person supervising an interaction between the two. But I do think that you could easily make the argument that it was necessary to form the opinion. And I don't know that it needs to be stated, but 10 to 15 minutes is not appropriate. 30 minutes, not appropriate. An hour may be appropriate, but these are not outside of the bonding. Parental fitness evaluations are serious evaluations. And I question the strength of an evaluation that doesn't include at least a couple hours of interviews with the parents.
Okay, that's really helpful to know too. So in part, I wanted to bring it up as an example of one that I am not a forensic evaluator, but in my humble opinion, was not really that well done. And just the difference between bonding assessments and parental fitness evaluations. So that's a helpful distinction. And this idea that it has great therapeutic value, but maybe not forensic value.
What are other people's thoughts? I will be honest, I've never done a bonding assessment. I know Amanda Newhouse does bonding assessments for therapeutic purposes, and I'm hoping that we're bringing her back to this to maybe we can have that conversation when she is available to attend the meeting. Okay. Because I think it's really important for us to understand the value of that assessment and treatment work in bonding. And I don't want the takeaway message to be Dr. Lillard thinks bonding assessments or thinks bonding is ridiculous. But I just want to piece apart the difference in what decisions are being made because of a bonding assessment. And I think that making a decision about whether a parent has custody of their child based on a bonding assessment strikes me as concerning, particularly if a child is taken from the parents at a very young age. How much is the bonding just based on the fact that the child has not been with the parent, and how much is it based on the parent's ability to be a parent? Right. Again, the Supreme Court says you have the constitutional right to parent your children as you see fit, as long as you're not abusing or neglecting them. So to me, to even have this conversation that the child is more bonded with the foster family than with the biological family, to me, strikes a constitutional concern about what we're saying if we're not giving those parents a chance to bond with their children because we are removing them. And I forget the study, but there has been research out there that says West Virginia removes kids per capita, removes kids quicker than any other state from parents' custody and terminates rights faster than almost every other state. And I don't say that as, maybe there are reasons and there's probably legitimate concerns that we have and issues going on in the state that are causing us to have to remove children so frequently. But I think it's important just to keep in mind.
Yeah, any other questions or comments from other folks, or even like the parental fitness evaluations you guys have seen, your thoughts about them?
How about bonding assessments? Have you guys received bonding assessments that you thought were really strong and helpful in decision making? I'll be honest, I think parental fitness assessments are a really important piece of the process, and I'm grateful that people are being referred for parental fitness evaluations. I hope that what you're getting back is something that is helpful and useful for you to complete your job and for the courts to complete their jobs when it comes to these cases. And I hope that the state as a whole can continue to support that endeavor. Brianna, do you mind if I read this out loud? She says she only knows of 2 bonding assessments in our county. She was not directly involved in them and doesn't have much to add. Sometimes workers will come to me with concerns on moving a child from a foster parent to a relative that they've had little contact with, but I have to remind them that they also did not have any contact with the foster parent prior to removal, and this is something that can be improved over time and should not prevent us from trying to place with a family member if they are willing to step up and be placement. Brianna, I think that's a really wonderful point to make. And I think it also, I think gives us a place to be creative. You don't have to, I don't know the rules, but I can't imagine that you have to just send the child immediately, permanently living with this family. I imagine that there are home visits, and that there are kind of trial runs, and ways to kind of help the child become comfortable with a new family. And I imagine that is going to be a rocky decision.
Yeah, I just wanted, you had mentioned the recommendation that patients come off medication assisted treatment. That's of concern to me. The ones that I have seen done in the Morgantown area that recommend that, I know that there was no contact with the treatment provider because we were the treatment provider in at least 4 of those parental fitness evaluations that I saw. And that was not consistent with our recommendation. So there was no misuse of the medication. The medication had contributed to the individual being stabilized in recovery and with substance use disorder in remission on medication. So I think it's important, if that is a recommendation that's coming through, has the evaluator contacted the provider, because that would be important to understand either the benefits or the risks of remaining on medication while parenting.
Yeah, and if at all possible, if CPS can facilitate the connection between providers and evaluators, that's wonderful. If they can facilitate any records gathering for evaluators, the evaluator should definitely be asking for records, wanting records, utilizing records, and it should be clearly noted in their evaluations. They should list out any records that they reviewed, any people that they talked to in the course of their evaluation. So those are all things you can definitely look for and encourage. I would encourage talking to treatment providers.
Thank you all so much. Any other comments, questions about the case or anything related to that? And thank you, Brianna, for your comment as well. That's really great. Thank you. Got a chat in from Anna saying thank you, Colleen. And anything else from the group before we get into the announcements? Alrighty, well, thank you all so much. And thank you, Laura, as well, for bringing the case today. As you know, the ECHO staff loves when we have a case presentation because it really does spark some great discussion and brings the group together. So thank you as well. All right, if there's nothing further, the only announcement I have is that the next session will be on June 21st, and Amanda Newhouse will be presenting on parent-child attachment. So keep an eye out for that reminder. Yeah, it's perfect. She'll be here. Keep an eye out for that reminder, and I'll be sending out the recap email with some of those items Dr. Lillard, you had mentioned as well. So we'll see you all next time. Have a wonderful rest of your day, everyone. Thank you. Take care.